Good afternoon. I'm Janelle Hom, Executive Director for your local American Lung Association here in Central Florida. And we're back with our July Lung Chat with our partners at AdventHealth. And today we're actually out at the Waterman campus, which is absolutely beautiful here in Lake County. And I have the honor and privilege of sitting here with Dr. Schroeder. So welcome to our Lung Chat.
Well, thank you very much for having me.
Absolutely. So aside from our audience knowing your name, if you can tell our audience a little bit about who you are and what you do here at AdventHealth.
Sure thing. So I am the pulmonary attendant for AdventHealth here at the Waterman campus. We have an office right across the street from the hospital. We see patients in the hospital and in our clinic across the street.
Excellent. Well, we really appreciate you being here and offering your expertise to our constituents today and people who are really curious, especially about COPD and lung cancer is what we're really going to hone in on today. And let's just talk a little bit about, people hear the term COPD all the time. I'll have people kind of guess like, what does the COPD actually mean? So can you tell us a little bit about what is COPD? Let's start there.
Sure thing. So COPD, that's an acronym, and the acronym stands for Chronic Obstructive Pulmonary Disease. And the obstruction is air can come in, but it's difficult to get out. And under the umbrella term of COPD, there's also emphysema and bronchitis. And so all those terms kind of get thrown together and it can be confusing for people. It's primarily a disease of smoking. And that's what causes this obstruction, is the destruction of your airways from smoking. And that creates these symptoms and this constellation of findings that we have given this name COPD.
But people can get COPD outside of smoking too, right?
That is correct. So there's occupational exposures and even diseases such as alpha-1 antitrypsin, or even asthmatics, if they've had asthma for a long time, can develop COPD as well. Yes.
Excellent. So really great information. We could go down a lot of different rabbit holes with that, but we'll stay focused today. Now, I was driving in, my car thermometer said it was 100 degrees outside, which seems pretty spot on. It's pretty darn hot outside, and we've got Saharan dust rolling in. So it's summertime in Florida, which for all of us, we're kind of struggling a little bit, but for a COPD patient, that can be especially challenging, right?
Yes, absolutely. So when it's hot like this, your body requires more energy just to keep you cool. And in using more energy, it uses more oxygen, and that can present as breathlessness or feeling short of breath. So what I advise patients is really plan your day around the weather the best that you can. Stay indoors during the hottest part of the day, dress accordingly, and drink water if you're outside and you notice you're sweating a lot, and just drink when you're thirsty. So those are kind of the best ways to deal with the heat if you have these underlying problems.
Absolutely. So now, if somebody, for whatever reason, isn't able to necessarily avoid the heat of the day, or maybe they're running into things that are causing them to have some exacerbations, what's the best thing that they can do if they are starting to have a little trouble?
Well, absolutely is to speak with their doctor. There are medications and treatments available for COPD, particularly if you're having breathlessness. There are inhaled medications that can help to help people get through their day. These medications, they're there to improve your quality of life, decrease hospitalizations and decrease cough. So that's what they're there for.
Absolutely. Now, I know with COPD, we talked about, smoking certainly being a major cause of that, and we're going to switch gears really quick and talk a little bit about lung cancer and some really exciting things that are happening here. But kind of on that same breath, we hear about lung cancer, and I think more and more of the public is being educated on lung cancer and what causes it, but let's talk about some of the causes around lung cancer.
Sure thing. Well, the most common cause is smoking and exposure to secondhand smoke, followed by radon exposure, which it sounds scary, but it's really this gas that is all around us, but in some homes it can be trapped. There's free test kits available that are available from the Department of Health if you're concerned about it. Here in Florida, that's not as much of a concern as other states.
Yeah, absolutely. That's definitely a big myth we've been fighting here in Florida for a while, and actually at upcoming events, you can actually get some of those coupons for a free radon test at some of our upcoming events, including the Lip Sync for Lungs event. Now, here at AdventHealth Waterman, I understand that you guys actually have a lung nodule clinic.
Yes.
Tell us about that.
Yeah, it's something I'm very excited about. It's been a kind of a passion project for me for a couple of years now. So the issue we were finding is that these lung nodules are being seen in patients, whether they're going for imaging for other reasons, or they're being found through screening, or they're being found on X-rays, and there wasn't a dedicated resource for those patients. They would be either referred by their primary care doctor, and unfortunately sometimes the process of just getting the referral can take time, or they didn't know what was available or who to see for these problems. So the purpose of the Lung Nodule Clinic was to be able to have this kind of set area and time and phone numbers and resources available to those people if they have these findings, that they could call, be seen by a physician, and have it appropriately worked up and followed.
That is really fantastic news, and definitely when we talk about anything to do with nodules or lung cancer, that just there is such a sense of urgency, and to have all of that really readily available is so exciting for patients and for caregivers, and to really make sure they have the information that they need.
Exactly. The good news is that the majority of lung nodules we do find are benign. There is a small percentage that are concerning. The problem is initially it's difficult to know which bucket you're in. And so the Lung Nodule Clinic will help either can provide a lot of people reassurance, or at least give them the workup that they need.
Absolutely. Now, in order to get to the place where we're talking about nodules, you have to be screened in some way. So let's talk about what are the guidelines for lung cancer screening today? Sure
thing. So the guidelines, if you're age 50 to 80, and you have a 20-pack year smoking history. So what does that mean? That means if you smoke 1 pack a day for 20 years, that's a 20-pack year smoking history. If you have quit over 15 years ago, then you don't qualify for screening anymore. Your risk of lung cancer is lower. But if you haven't quit within the 15 years, then you'd still qualify.
Excellent. And if you have questions about lung cancer screening, absolutely, you can reach out to AdventHealth. Also, through the American Lung Association, we have the Save by the Scan campaign. You can go to savebythescan.org, and there is a self-assessment quiz you can take that can help with that pack history, because sometimes math is hard, right? So if the screening does show something, what are those next steps? Are they going immediately to this nodule clinic, or tell us about what that process looks like?
Sure thing. So that was the purpose of the nodule clinic. So what happens a lot of times is people get these results, and then they don't know what to do with them. And it shows these lung nodules, and they go online, they type in lung nodules, and unfortunately the first thing that pops up on Google is like the worst case scenario. So the goal would be they could reach out to this clinic and speak to our lung nodule navigator, Janet Moore, and then be screened or be seen by myself or my partner, Dr. Iskander, in a timely fashion, so we can work this up or offer further surveillance or reassurance if necessary.
That's fantastic. So it's a very streamlined process, and people are able to get answers that they need quickly and get fantastic care. So that really wraps up our questions for today. Is there anything else you wanted to add about anything we've talked about, or how people can find you?
Oh, sure thing. So as far as information for the clinic will be available on the AdventHealth Waterman website. We would have a dedicated phone number, fax number, and email address for the Lung Nodule Clinic in a way to try to make it easy for patients to reach us. And that'll be available on the show notes, if you will.
Absolutely. So for those joining us on Facebook Live, we will add that to the comments. And for those that are going to be viewing this on YouTube or on the edited video, you will see some credits with some links to some of these really fantastic resources. As always, the American Lung Association has our lung helpline available with free resources. But thank you again to our great partners here at AdventHealth, the amazing work that you're doing throughout Central Florida and beyond. We really do appreciate you.
Thank you. Thank you very much for having me.
Thank you.